Welcome back, everybody. We have another episode of the Health Optimization Medicine Podcast. We're currently in the top 25, guys, of all life sciences podcasts in the United States, which is rocking and rolling. We've had episodes with David Perlmutter and also, of course, these amazing conversational episodes where we give people, clinicians' perspectives on really how to optimize for health and using, of course, our clinical framework in health optimization medicine practice. But I want to tell, well, I haven't told you guys what happened to me on Saturday. Can somebody guess what happened to me on Saturday?
You got a haircut?
Oh, that's thank you. Thank you for noticing. I really appreciate that. So for those listening,
you bought a mentally challenged person.
No, don't do that. Okay. So this is
is that woke? That's
so I typically wake up at like 5:30 in the morning, right? And so around 6:30, it's starting to get nice here in Chicago. And so I'm like, I'm going to go for a bike ride on Lakeshore because you can do those things. But that morning I was walking back from the storage place because I had to pick something up there on the street. It's kind of a bordering, not so great part of Chicago. There's a guy who's clearly just like off his racket, right? And I swear you guys are going to smile at some point because otherwise this is just going to be like me practicing stand-up.
It's comedy sketch. I feel like you're working on your material here.
Yeah, working on my material. So typically you kind of ignore these people, right? They're tweaking out or whatever. And this guy came over to me and he was just absolutely desperate. He's like, man, can you just... And I initially waved him away. He's like, no, I just want food. And so it was Saturday morning. I'm by myself. I figured, why not, right? Go and buy the guy food, but you can clearly tell that there's something off about him. And I got like this guy's life story about how this happened, how he came to this point where he's on Chicago Avenue in downtown Chicago and, just sort of walking around and has like this issue. And so I guess the whole thing made me feel grateful for about, my mental health in particular. And essentially what this guy had been through is he made a couple of wrong decisions, got started on the drugs way too early. And because he eventually, you guys would tell me as sort of pharmacokinetics experts or pharmacogenetics experts more than me, that he was chasing the high. And so started early in sort of dopaminergic drugs like cocaine, and then eventually found himself taking meth, right? And so this guy asked me to buy him a coffee and a bagel. We were at Starbucks. And guess what he ordered? Cafe mocha frappuccino with very cool, very actually like almost spot on, right? And so not only did I offer the guy this breakfast, but he orders the most expensive thing in Starbucks. So anyway, so that was my $15 later. But it did make me appreciate mental health, right? Because this guy is now in a position, he doesn't want to be there, but his state is such that he has to do this to get back to feeling normal. So anyway, today we're talking about mental health optimization. And if that sort of preamble doesn't make the final cut of this episode, that's okay.
Actually, what that indicates is that we always classify addiction as a mental health disease. No, addiction is addiction, right? It's a different kind of disease altogether. It involves mental health, but it is in a class of its own because one can be addicted to activities and one can be addicted to, in enlightened circles, you're addicted to thinking, right? So,
or health, or health.
So, you can be addicted to health or you can be addicted to being alive, right? So all of these things are forms of addiction. It's just that there are definitions of addiction, right? It's like when you cannot function anymore. That's why they're functional alcoholics, right? For example. But that's all when you look at all those things, it's like if you just take out the brain in the process and just take a look at the cell itself, then we could actually have a better way of taking a look at mental health, right? Because the brain contains neurons and the neurons actually are cells in themselves that have fundamental structure. They have cells, they have mitochondria, they have nucleus, mitochondria, cytoplasm, cell membranes, plasmic reticulum, and so on and so forth. And, when standard psychiatry would diagnose disease, what we're looking at is like, how are these cellular networks inside your brain actually communicating, miscommunicating? Are they threatened? Are they not? are they inflamed? Are they proliferating? Are they, for brain fog, for example, do they have enough production of energy and so on? So that's the way we look at this in terms of health optimization medicine, right? Let's forget about the actual diagnosis that's in there, and let's take a look at what the cells and the cellular network is actually doing. After all, the neurons are just specialized cells, I say. But yes, it contains everything else, but it just actually specialized into the neuron, right? So when we're looking at this, so when we're shifting everything to the cellular level, right? We take a look at first, the most visible to us is, when patients or clients complain of brain fog, immediately we look to the thyroid, no? Instead of just looking at, is the brain actually producing enough energy to do so, right? And that's only half of the story, right? So when we know that the body uses 20%, the brain uses 20% of the brain's energy, right? But that's just, even if you're not thinking about things that are beneficial to humanity and to the rest of the world. Plotting a murder, for example, would require a lot more energy. But anyway, we always know that the mitochondria will actually produce energy, right? However, that's only half the story. Mitochondria are sensors. They will sense, what's going on outside, and they will cry if it's in danger. If you are taking like meth and these other substances that places the cell in overdrive, the cell senses all of this, right? And it will actually cause the brain to inflame. And so we have actually markers for brain inflammation that we can see in a clinical metabolomics testing, right?
Yeah,
Jodi?
we do.
I know. Yeah, chirinic acid. Boom, boom. Mic drop.
There's a ratio.
So Scott, you were saying it's a ratio, right?
Yes, the ratio. And what's interesting is that I have a patient of mine who I didn't realize when I first started working with her that she was vaping all the time. And it was her ratio of these particular metabolites that we can talk about. This ratio was significantly in a place where she had significant brain inflammation. And as a result, it was obvious to me that I was like, what's going on here? And then she's like, I didn't tell you that I'd been vaping, and did I? And I was like, no, that would have been nice. That would have been nice for you to tell me. So.
I have a patient, in fact, who said he's quit, right? He's not taking cocaine anymore and all that stuff. And then I take a look at his clinical metabolomic test results, right? He's like dopamine metabolite, which is what?
Oh, I've seen these, but I've seen this particular patient's test results before. Yeah.
Yeah, so it's your homovanillic acid, right? Totally down to zero. So it's like the brain was just so flat out of dopamine that anything that you try to do to resuscitate it is difficult. And then I just basically looked at him and said, he started taking again. I said, yeah. Okay. So you can actually see these things, even if your patients are lying to you, right?
Ted, I have a question for you. I've been thinking about this, because so many thousands of mitochondria per cell in our brain specifically. We have is the most in our reproductive organs, and then after that is the brain and the neurons and things. I was thinking about this when you're thinking about, just thinking in general, like nuanced thinking versus black and white thinking. Would it be easier for the brain to think in black and white, and therefore if you don't have enough energy capacity, like you just think more in black and white, versus somebody that has more energy capacity of the brain, they can think more in nuance, like thinking more in the gray? Or is that something that I'm just making up? I was wondering.
No, well, actually, it depends on your sensor, right? If your sensor can see only black and white, then, your brain will actually do patterns in black and white. Remember that this has already been proven in cats, right? Where if you don't train, but this is on a different level. If you don't train the part of the brain that's actually responsible for vision, that which is responsible for hearing will actually take over. Right? And this is a cruel experiment, but it was done by some Yale researchers. They closed the eyes of newborn kittens, right?
Sure.
And then they reopened it afterwards. So the kittens were blind after the critical window by which the sight was formed, right? And then after that, but they had very keen sense of hearing. So you could see then that there's no nature or nurture argument. That's basically a very, very false argument. Nature starts the blueprint and then nurture completes it, right? You put the kit into light, etc. It's the same thing with color, right? For example, essentially your sensor is not seeing color properly, right? Then your brain is actually going to produce images that are actually of that kind of quality of color, right? I remember as a child, I had severe astigmatism. And whenever I draw an electrical post, where I grew up, there were electrical posts that were on the street, right? And I would draw the post in a straight line and I would fuzz up the edges because that's how I saw them.
Scott, did you draw electrical posts when you were younger?
I, of course, drew stick figures that had electrical posts looking like kind of figures, probably.
Okay. Fair enough. Yeah.
But I wasn't in the detail of looking at the fuzz on the outside, so.
The fun is in the fuzz.
Yeah.
So let's get back to the part of your question. Yeah, it depends on what what nurture completes, right?
Okay.
So what the external environment.
So it's not necessarily a brain energy. Like I always thought, if you don't have enough energy capacity, your mitochondria are having significant challenges either making or detoxing from the energy that we do make, that it would be like only being able to do the very important functions of keeping you alive and survival mostly. And that's mostly related to black and white thinking, right? Am I going to live or am I going to die? Am I going to procreate or am I not going to procreate? Whatever it might be. And that's my sense of maybe why we get so polarized with.
No, I think it's more sensor dependent, right?
Okay.
It's more sensitive dependent. When I was doing research on this many years ago, we found out that the brain actually just responds to particular features of an image. Right. It responds to vertical lines, horizontal lines, this direction, that direction. In other words, it's just an abstraction of what you're seeing, right? And that's a blueprint of what you see. In fact, there's an old story about when the Spanish came with their huge ships, etc., and came to a native island. And they were trying to point to the ships. The conquistadores were trying to point to the ships, and the natives actually couldn't see it because it were so large and not in their experience to see anything, so they couldn't see anything. But they could see all of those thingies that came from the ships because they were small enough and it was actually registered in the brain. But we digress. We are actually looking at the mitochondria producing energy and mitochondria actually sensing the assaults on it and therefore causing inflammation, right? And this inflammation is measured with canurenic acid. And, a quick reversal of this type of thing can be done with what vitamin?
Call me coach. Call me coach.
Yes, you.
Sorry, no, Jodi got it already.
Yes,
Jodi spoke out of turn, but she got it right.
Never speaks out of turn, Jodi.
No.
Jodi, what are your thoughts on this too? I just, because I know we see a lot of women and men, I know, but also with a lot of mental health issues. And I know that you're seeing a lot of people come through practice and looking at a lot of their ratios, looking at a lot of their vitamins and minerals. I mean, what are some of the things that you see most often when you're looking at it from a health optimization perspective?
Yeah, so organic acids, I see most people I see, other than my client who has Parkinson's and is on L-DOPA, majority is HVA and VMA are bottomed, and it's quite, it matches their symptoms. And I think it's really nice for them to see that when they're feeling so despondent and unmotivated and really low. And so they feel much better about seeing that there's a reason for something and what they're feeling. So I don't often see, obviously I'm looking at the quinolic and the chynuric. I'm not seeing as much B6 deficiency these days. So I did a couple of years ago, but I feel like there is a little bit more awareness around, and a lot of people are taking multi-B supplements for MTHFR reasons, and so there's a little bit more support there. But now I'm seeing a little bit more on the oxidative and the inflammatory component, and still not really getting to the all the details that we need to be balancing the mitochondrial energy and the cell. And then we've got exposomics that are coming in, I feel, in much bigger amounts, and even not just awareness, but in the last few years. So you've got sort of these balances, like maybe vitamin deficiencies, and we're correcting a little bit better, but then we've got more issues associated with the environment and trauma and stress, and then that puts a higher demand on the mitochondria and the energy as well. We're not sleeping as well. So I think, as we always talk about at Home Hope, there's always this balance. Like we can see it and focus on the testing because clients then go, I can see that now, right? More tyrosine. And generally that comes along with a thyroid or a lowered thyroid output. And so you're getting all these cofactors and they know that they've got the building blocks there. But if they still don't do the lifestyle, the stress, the gym work, the BDNF building and all these other things that we know that we should be doing, then they still don't get
books.
outcomes.
They need to read books too.
Can't you just raise BDNF with like microdosing LSD?
And holy basil too.
I was going to mention the psychedelics after this because a complete mental health talk is not complete without that.
So
I think Ted had a line on this before on mental health and in the case of a certain type of deficiency.
Yeah.
Exactly.
So one thing I want to interject with here, because you mentioned vitamin B6, Ted, and that kind of ties a little bit into how we relax, right? And Dr. Sherr, has talked a lot about parasympathetic nervous system.
The spiral of
Let's go a little bit into that spiral of doom and how it plays a role in GABA and what we need to do there.
Yeah, I think I was thinking about this as you were talking too, Ted. I mean, when I was in medical school, and I'm sure when you were in medical school too, probably at maybe actually a little bit after you were in school, the big thing was that depression was a serotonin deficiency, right?
yes.
Everybody that had depression had low serotonin levels, but they've done a number of meta-analysis over the last couple of years. There's no such thing as low serotonin levels in depressed people. It's not any lower than people that don't have depression.
Yeah, it's only from caffeinone abuse, man.
Well, that's a different story. That can be for another day and another podcast. But serotonin deficiency, it doesn't exist in the sense of it causing depression. I mean, at least probably in some rare occasions, but in general, not the case, right? So when you artificially increase serotonin levels, you make people happier sometimes, but it does take a long time for that to happen, 4 or 6 weeks. But the studies are actually pretty clear that GABA deficiency is much more associated with depression, also anxiety and insomnia, than the serotonin. And so when you think about that, you're thinking about, well, why are people so GABA deficient all the time, right? And that comes down to a lot of the work we do at Home Hope, which is optimizing micronutrients, the gut, cellular biology. But a big overlying piece of this, of course, is like
remember
the
it used to be
aspect of
just
it.
it used to be just a bipartite axis. Actually, we called it the gut-brain axis, right? But we know it's actually a tripartite axis. It's a gut-brain microbiota axis because the microbiota in Home Hope, we consider the microbiota as actually a separate organ in itself. It produces some metabolites, it has a metabolism, and so on. And remember also that when you are supplying the precursor amino acids to the brain neurotransmitters, the brain actually, these are huge amino acids, right? The brain actually have active transporters for them. They're called large neutral amino acid transporters because they're actually large. So you could see here that that's why the gut is called the second brain too, right? It produces, I think, 98% of the serotonin that we use, and then the brain produces only 2%, but it produces it on its own, right? So you could see here that the effect of that tripartite axis actually on brain inflammation, also the studies on exposomics, right? Like your exposure to particular things like sunlight and so on, which is also tied to chronobiology, then actually affects how your brain cells actually respond to different types of stimuli. Mm-hmm. Right? So when you're taking a look at all of this, when you are able to manipulate the levels in the cells such that they are at optimal levels between 21 and 30 years old, you could see then this actually, it's not just a ripple, this actually is a wave that actually activates the entire neural network of the brain. And that is, just knowing that actually makes you think about how fundamental it is to take a look at cellular health first before you actually put in a diagnosis, right? As I said, one of my favorite examples here is that you give a woman a contraceptive, right? And the contraceptive actually will sequester your vitamin B6, and the patient actually falls into depression within 2 days of taking the contraceptive, right? So you could see there how important vitamin B6 is to the brain. So immediately you see all of these cofactors are really very, very important to optimize brain function and actually optimize mental health, right? And as I'd like to say, there can be no true mental health optimization without prior cell health optimization, right? So
yeah, just add on that with the the sympathetic side of things, which is interesting, right? Which is when somebody's in fight or flight all the time, they're churning out, like just when your friend, the meth addict, was taking meth all the time, it's like a simulation of being in fight or flight all the time. You're just pumping out cortisol and norepinephrine and epinephrine. Like his organic acid panel would have been very interesting to see, I'm sure.
We'll get it back in 6 weeks.
Nice, perfect. And then he's going to be very compliant about his supplement regimen with you, I'm sure. But it's kind of the elephant in the room for a lot of people, which is that like you can sometimes give people supplements until the proverbial cows come home. But if they don't have that sympathetic down regulation, getting into that more parasympathetic mode, ain't nothing going to change. I just use a double negative, Ted. Sorry about that. But that's what it comes down to. And what I found over the years is that you can't just downregulate somebody's nervous system without giving them some cellular support too, though. That's the thing, is if you just give them some stuff to downregulate and calm down, they can crash on you if you're not careful.
Yeah, and there's this wrong notion. It's like, oh, I'm taking this supplement for my brain. And you take a look, it's like, no, actually, this is good for all of your cells. So the key there is actually to measure, right? Measure your metabolite levels, as Jodi was saying. You use clinical metabolomics to do that. You optimize those values to between 21 and 30 years old, because that's supposed to be the peak of brain function. But I don't know what the brain function now of 21 to 30 years old with the advent of social media.
This is the problem.
I mean, it's the first generation with a declining IQ, right?
Yes, yes, a very much reduced attention span.
Yeah.
Right? Because the brain is a highly trainable machine, right? It's like an LLM. It's a large language model. It's what you train it with. You're training it with short things, and it will only have attention for short things, right? And now it's like the little funny things that come up are actually, if you write the concepts down by hand, you will memorize them better. I think, it's just like those are recruiting two networks in the brain to actually help you learn.
I think people are learning better in school now because they have to actually write out their exams in front of the teacher instead of having it on the computer as well.
Yeah, but you know what, Scott? That was how we did exams before.
Me too. That's how I did it.
Me as well.
I do too.
All right, so we need to kind of wrap things up, guys. We're coming up here on time. Mental health optimization from a home health perspective. Who wants to give us a little rundown here? What happened today?
Okay, so in mental health optimization from a health optimization that's in perspective is we set aside whatever the disease diagnosis is, right? We take a look, we test the clinical metabolomics, take a look at the neurotransmitter levels. The neurotransmitter levels there, by the way, are actually correlated with your platelet neurotransmitters, right? And there's just a statistical correlation between them. And then from there, you could take a look at what can be corrected, right away. And then when you correct those, you could see immediately that the brain stops fogging up. And then there's a lot of more mental energy, there's more clarity and so on. And that is not even counting the fact that, we're not talking about the disease yet, right? So one of the roles of the practitioners is actually take a look. The brain is usually arrested in the salivary response of inflammation, right? It will arrest there. But with the rise of canurenic acid, and you could see usually a lack of vitamin B6. But there's also a lot of other factors like the exposomics. Like, for example, if the patient or client is taking drugs, that's an increased pressure, right? If they lack sleep and so on, that actually contributes to brain inflammation, right? Because if you lack sleep, the brain cannot clear out its debris in the lymphatic system. That's a new lymphatic system that was discovered in the brain. It's covered in 2012. Right? And then when you are taking a look at the brain also, you have to take a look at what the tripartite axis is doing, the gut-brain-microbiome axis, because that's actually been shown that what the microbiota are producing is actually related to anxiety and depression. And that's already been shown in the clinics episode. That's why they have been formulating probiotics for those particular diagnoses, right? But for me, it's like, no, let's not do the diagnosis. Take a look at it from a cellular level and from the body as an ecosystem level, right? So let's do precision measurement, right? Let's take a look at what we can return into those optimal values. And then we could see that all the other relief of the diseases is basically a beneficial side effect of just optimizing what the cell really needs, right?
I'll just add to that. I mean, we can't, have the conversation without thinking about the overt aspects that many people are talking about now, trauma and challenges with that aspect of severe illness and other kinds of things that can be very difficult. But
traumatic brain injury, right? TBI, which is very common,
right? For sure.
And again, most of those people are actually stuck at CDR1 or cellular
Right.
response 1, right?
Right. That's important.
Yeah.
But I think in the end, as you said, true brain health optimization starts with health optimization, medicine and practice, cellular optimization strategies. And then that's really what
Layering on top.
is shifting our patients and clients on a regular basis. I know that for sure.
Begin with the fun fact, let's end with one. Did you know that you're actually operating a pneumatic drill, right? If you're operating a pneumatic drill, or you haven't done, the vibration of a pneumatic drill when you're drilling into concrete is enough actually shake your pituitary, right?
Yeah.
Your pituitary gland in there, such that it appears like it is actually in a TBI, traumatic brain injury, right?
Yeah.
And then it will start producing growth hormone. It will start producing all these things it's supposed to do for you. And then we diagnose them with an endocrine disease where actually it's been brain trauma, right? It's like, oh, I'm so glad I never have to operate a pneumatic drill.
Oh, Ted, I think one other quick story would be good is to maybe finish off is in your patient with bipolar disorder and talking about that quickly just as a final, because I think that's a great summation of what we do and how it works.
I don't know. I don't have any patient with bipolar disorder.
Yes, they reversed the diagnosis and don't have it anymore, as I recall, right?
Yes. I had actually a 19-year-old, right, who was diagnosed with bipolar disorder and was placed on Abilify, right? But what happened was that, of course, with Abilify, you don't get interested in your hygiene, and then essentially you get fat, right, and so on. What happened there is that I took a look at these hormones, I took a look at this metabolome, and so on. And in 3 years, right, he was able, from being out of school, he was able to get back into second year college and then graduated and took his master's. And then when we were talking in my clinic, I said, Dr. Ted, I want to, because he lost so much weight, etc. I was like, how can I get rid of these skin folds and stuff? And they said, why? He said, because I'm appearing in a music video. And that's a wonderful story, right? I really like to share. It's because the mother is a dear colleague of mine who then said, oh my God, this is such a wonderful thing to learn, and started to learn how to do this.
Beautiful. All right. We all need to be in a music video. Should we round this one out, guys?
Yeah, thanks for
All right. So thank you guys all for joining us here on another episode of the Health Optimization Medicine Podcast. Dr. Ted, Dr. Scott, Jodi, thank you. It's been a fantastic one on mental health and the role a home health practitioner plays. Everybody, have a wonderful day. Remember, choose health.
Whoop. Bye.